Are you having pain at the front of your shoulder? My go-to treatment for relief is cupping therapy. I start off the session by putting on baby oil around the shoulder joint where I'll be doing massage cupping. Now, for my cupping therapy sessions, I like to do two different styles of cupping. I'll do massage cupping and vacuum suction cupping for my patients because I find that it gives them the best results. As you can see here, I'm using a medium-sized silicone cup to start off the massage cupping. I'm focusing around the shoulder joint and the deltoid where my patients often have a lot of muscle and myofascial tightness when they tell me that they're having pain in the front of the shoulder and some pinching. Along with the benefits of decreasing muscle and myofascial tightness, cupping therapy can also help with decreasing inflammation, increasing blood flow to bring new nutrients to help with healing, and increasing range of motion. Oftentimes, even after the first cupping therapy session, a lot of my patients will notice a difference at the end. Once I cover a good bit of the shoulder, I'll switch to a smaller cup that can target a more localized area. Now, sometimes this feels a little pinchy for the patient, but I'll always adjust the suction to what's tolerable for them. So even if we have to use a little less suction, that's totally fine. We can still have great benefits. I'll usually do massage cupping for about 5 minutes for a certain region and then I'll move on to a different region. I don't do this one too much because it can be a little bit tender for the areas that are really tight. For my patient here, there isn't really that much of a petechia response coming up with the massage cupping, but once we switch over to the vacuum suction cups, you'll start to see some of those cupping marks that are pretty well known from the Michael Phelps picture from Beijing Olympics. After I get done with massage cupping, I'll go ahead and switch over to the vacuum suction cups. I love to finish with this style of cupping because it goes deeper into the muscle and tends to be more relaxing. Now, in the beginning, when we are putting the suction, your body's still getting used to it, so it can feel a little bit more intense. I'll tell my patients to breathe into that area and help them relax a little bit more. And then after about a minute or so, it starts to numb out. And that's where it'll start to stimulate the parasympathetic nervous system, which is also another reason why cupping therapy can help with stress and anxiety. If you're interested in learning more about the different styles of cupping, then I'll go ahead and link one of my videos that goes into more detail up above. Back to the vacuum suction cupping. If you are someone who loves deep tissue massages, then you'll most likely prefer maximum suction with the vacuum suction cups. After placing all of the vacuum suction cups on the region, I'll usually leave it on for about 5 to 15 minutes depending on the patient, and then you'll start to see some cupping marks arise from the areas that have a lot of muscle stagnation. So once the time is up, I'm just pulling on the top of the cup there to help release it, and you can see the areas that I've released right now have just a very light redness. But at the front of the shoulder, you can already see, without me even removing the cups yet, that it is dark red and purple. Patients who are usually experiencing shoulder pain at the front of the shoulder, who have tight pecs, or are experiencing biceps tendonitis will usually get these cupping marks. The colored marks have different meanings, and the time it takes for it to fade varies as well. After the last cup is removed, I remind my patients to hydrate. And there we have it, the cupping marks at the end of a shoulder session. If you are interested in learning more about what those marks mean, check out my most popular cupping marks video right over here. And don't forget to like and subscribe as well. Thanks, everyone. Bye.